My name is Katherine Spillar. I'm the Executive Vice President of the Feminist Majority Foundation and have led for 23 years our National Clinic Access Project, organizing communities to protect clinics that have come under attack by anti-abortion extremists. And I'm very honored to be here today and to join Dr. Carhart and his courageous staff of dedicated professional medical personnel. And I am very honored to join with a very large national coming together of supporters of abortion rights and women's rights and medical professionals that you see lining the streets today of Bellevue. We have come from all corners and from local, everywhere locally, to stand with the doctors and the medical professionals who are under attack by an extremist wing of the anti-abortion movement. For 30 years, more than 30 years now, we have watched growing extremism by those who are opposed to abortion and birth control, who have lost in the arena of public opinion, who lose at the ballot box when they put their extreme initiatives up for a vote, just right here in South Dakota, twice defeated, who have lost in the legislatures and in the courts of this country and have turned to violence and to intimidation and threats. And our message today to Operation Rescue and to all those around the country who are targeting Nebraska and targeting Dr. Carhart with threats and with intimidation and with violence, you cannot win. You cannot stop the provision of critical medical services. You cannot intimidate those of us who stand for medical science and reproductive health care. And that's what we're talking about. And we will work with law enforcement, locally and nationally. We are working with the Department of Justice. We are working to undertake civil litigation. We are working to mobilize community support. We will not be intimidated. This campaign of terror and violence that has grown more severe over the last 30 years will end. This is a democracy. We do not settle our differences at the end of a gun. We believe in peaceful provision of vital medical services, and we will do everything to ensure that clinics that are providing a critical medical service are able to operate in peace and nonviolence. 1 in 5 medical clinics in this country that provide abortions are under attack violently. 1 in 5, 20%. It's unacceptable. And the level of violence is totally unacceptable. And it's not religious zealots, but an orchestrated campaign of murder and terror. And it will be ended because the American people have spoken. We are going to keep abortion legal and accessible in this country. And you are witnessing people who themselves have traveled great distances to be here to make sure that that message goes out. There is a united women's rights movement that has worked for 30 years and is very forceful today in dealing with this threat. Thank you. Did you want to take any questions?
I want to first introduce Ryan. This is Ryan Swanek, and he has a few words to say about the local fund that we've had here since 2000. And then I guess I can give you like probably 5 minutes or 10 minutes for questions.
I'm the Director of Development for the Abortion Access Fund here at the clinic. And this is going to become a vital role because, as everyone has spoken so eloquently about the various hurdles that women have to jump through to access abortion care here in this country, we don't think that finances should be another barrier. So we're hoping to increase the activity of this fund and bring in funds to help women who could maybe not otherwise afford abortion care be able to access that, which is really crucial. And also in tangent with that, we have a Pledge a Picket program that we'll be starting here to send a message to the anti-choice protesters who stand outside that the more that they show up, the more money that they will help to raise to pay for women who might not otherwise be able to afford abortions. So these two programs will be what I'll be focusing on to help the clinic and help women obtain safe, legal abortion care.
Thanks.